Hi everyone, my name is Victoria Andriets and I'm a registered pharmacist with a Bachelor of Science in Pharmacy, and I'm the pharmacist owner of the Shoppers Drug Mart here in King City. And the topic for today I'm going to be discussing is substance abuse awareness and why is it important for caregivers, with a focus of alcohol medication interactions as well as seniors. So first I will be discussing what is substance abuse. I'm also going to be talking about how to recognize substance abuse in the seniors, because as caregivers, I think that's a very important topic to talk about. Then we're going to discuss why seniors are at a higher risk of alcohol medication interactions and other medication interactions as a whole. We're going to discuss how alcohol medication interactions occur, as well what are common interactions, and how we as pharmacists can help you out. So first, substance abuse is excessive use of a substance, including alcohol and drug, but not only specifically cut down to alcohol and drugs. There are other substances out there. So you might be wondering, why is it a concern? Well, it's a concern because it has a negative impact, not only on your own health, on the health of those you're taking care of, but also on the health and well-being of those around you. There's also many kind of interactions that can occur. There are drug-drug interactions, the smoking drug interactions, as well as alcohol-drug interactions. And again, my focus is going to be the alcohol-drug interactions. So how would you identify substance abuse in those around you? Well, the usual red flags for substance abuse may not be present for your loved ones. Those would include change in employment or withdrawal from society. However, the signs for substance abuse in seniors can often be mistaken for other health conditions or the natural signs of aging. And those would be memory loss, frequent falls and injuries, chronic diarrhea, fluctuating moods, malnutrition, and isolation. Having said that, just because the person you're taking care of has these symptoms does not mean that they are abusing a substance. But it is something that should be looked into. So let's discuss a little bit about why these alcohol medication interactions are important. We're going to look at statistics first. So there are over 5,000 prescription drugs available in Canada, and doctors write about 250 million prescriptions a year. There are also about 17,000 medications available without prescription. So what? About 70% of adult population drink occasionally, and about 10% drink daily. Now, about 10% those over the age of 60 or older living in the community abuse alcohol, and most of us are not even aware of that. And on top of that, it is estimated that alcohol medication interactions may be a factor in up to 25% of all emergency room visits. That's a huge number. So, why are seniors at a higher risk? Well, seniors generally have a higher number of medications that they're taking. Most of those who end up in the emergency have 3 or more medication prescriptions, as well as 5 or more medical conditions. There's also physiological changes as we get older. That includes change in body composition, so loss of body muscle and increased fat. There's a reduced efficacy of how the kidneys work, so the medications and alcohol don't get eliminated as easily. And as well, the liver functions differently. So having said that, what does that mean in terms for seniors and alcohol? Well, alcohol absorbs faster and stays in their blood longer than somebody who's younger. That means that the same amount of alcohol produces greater effect. It also stays around longer, so it increases the potential for interaction of medications. It also increases the effect it has on their brain function, therefore increasing risk of falls. And we all know that's a huge concern for all of us. It may also trigger and worsen medical conditions such as diabetes, depression, or blood pressure. So most of you would have seen this sign on your prescriptions. Do not drink alcohol beverages when taking this medication. So what you would say? Well, alcohol and medications can interact and be harmful even if they're not taken at the same time. There's a lot of longer-acting formulations of medications out there. And in seniors, when the medication eliminates at a slower rate, that means it has a higher potential to interact with medications. Alcohol can also magnify effects of some medications in the brain. such as benzodiazepines, which we all use, a lot of us use for sleeping, and such as lorazepam, for example. That increases sedation, dizziness, and depression. Alcohol competes with some medications from the same set of enzymes in the liver. And enzymes are like scissors that need to break down medications before it can be eliminated. So when the alcohol competes for those same spots on the liver that are supposed to be there to break down the medication, that means the medication levels increase in the bloodstream. And that's getting into this next slide. It's a little bit busier, but I'll take you through it step by step. And that's exactly about how alcohol medications interact in the liver. So in the absence of alcohol, we have a medication, which together with an enzyme, which is, again, the scissors that break down the medication, they form drug metabolites, which are these little pieces of drugs, which then can be eliminated. If we don't break down the drug, some of these medications, not all medications go through this process, but if these medications don't go through the process, they can't be eliminated and they stay in the bloodstream. So what does that mean for somebody with moderate alcohol consumption? Well, the same drug now has alcohol competing for those same scissors, for the same steps. So that reduces the amount of the medication that can be broken down and reduces the amount of medication that can be eliminated, which means that there's higher level of this medication all of a sudden in our bloodstream, which is going to be there for interactions and side effects. Now, somebody who's a heavy drinker, it's slightly different because the body makes up for this competition by supercharging these scissors, these enzymes, and it supercharges them, making a higher number of them. So the same amount of drug when the person is not drinking is all of a sudden going to be cut down really quickly and at a higher extent, which means that there is more of it being eliminated. That means there's all of a sudden too little of the medication in the bloodstream, which means that the person, when they're sober, may result in too high blood pressure, and some medications are going to be increased in doses. Now, when the person who's a heavy drinker is drinking, it actually works very similarly to moderate alcohol consumption, because the drug, even though there are supercharged enzymes, is still competing with the alcohol, and the alcohol takes over, and the elimination is reduced, so we have higher level of the medications in our blood system. Now, going back to the heavy drinker with sobers, I forgot to mention that when there's these little pieces of the drug in there, when they're getting really chopped down and there's too many of them, they can cause issues as well by causing toxicity and causing other side effects. So I know that there's kind of intense, but I hope it's fairly clear. And if not, you guys can talk to me afterwards and we can go over it again. Leaving the liver, that mechanism aside, there's also some medication that can lead to unpleasant reactions and result in serious medical consequences even after ingesting only a small amount of alcohol. And I mean a drink or two, and that's it. And that will include symptoms like flushing, nausea, vomiting, sweating, rapid heartbeat, and low blood pressure. And really, honestly, none of us want to end up like that. The types of medication could be common ones, such as your metronidazole, sulfamethoxazole, nitroglycerin, and glyburide. These are used as antibiotics to help with chest pains and diabetes. And just a drink or two often would result in these symptoms. So you might be wondering what classes of medications are affected by this. Some medications that I'm taking or the person I'm taking care of could be interacting with alcohol. Well, as you can see, there's a long list of types of medications that would fall into those kinds of interactions. And all of these are a concern for us, including herbals, pain medication, sedatives, and diabetic medication, which a lot of the people we're taking care of are on. So what can we as pharmacists do for you? Well, there's a lot that we can do for you, but some of the things we can do is help you to give you information about your medical conditions. We have information about your medication. We can also monitor the use of your medication and make it easier for you to remember to take your medications or the person you're taking care of, because honestly, there's probably a lot of medications out there for them, and you might have a hard time keeping track which ones in the morning, which ones at night. Did they take them? Did they not? We can make that easier for you. Just ask us how. We can also help give you advice on all kinds of data that you might hear and information on the media. And to be honest, the media can be very confusing sometimes. And lastly, but there's a lot more we can do, but often we do med checks, which are a complete review of all the medication of the person, including their herbal medications, to determine if there are interactions or if they're taken properly. I want to thank you for the time, and as well as if you have any questions, feel free to come up and ask me later. And thank you, Mary, for this opportunity. Thank you.